today. So this is just a little bit about why speed of delivery matters. So you're going to get a dose of nicotine inhaled from a cigarette or inhaled from a vape, or you're going to get it from a patch. And this just shows you, I just did this cute little thing showing you the speed of delivery, the neurological responses, the vascular effects, and the dependency potential. So here it goes like this. Patch is not a patch addict on the planet. Nobody's addicted to patches. So this is just to show you the speed of delivery matters. Vapes are right up the top. Sure, lots of people very addicted. It's very fast. It has a huge neurological effect, huge vascular effects, huge dependency potential. As I said, not a patch addict on the planet. Never seen one. Nobody puts a patch on and goes, oh, that's better, you know, love it. No. It's hours later. Patches take hours and hours to peak, maybe 6 hours. 6 hours, not 6 seconds, right? They take forever. And they're very low in dose, so slow and low. And this is a little hierarchy I've just developed just to show you so that you can have a look at where cigarettes used to be at the top and now vapes are up, right up the top. There's a nicotine nasal spray we used to have, oral spray. So these things are dependence producing. And so we do see an oral spray addict. I have seen them. People addicted to snus, people, the inhalators, the lozenges, the gum, less and less dependence producing, less cardiovascular effects. So don't get concerned about, say, the cardiovascular effects of patches, really negligible, if any at all. We've done studies and trials enough to show it doesn't do anything to your vasculature, but vapes do the opposite. Terrible for your vasculature. So I was talking a little bit about the delivery of nicotine. It's the ideal way is to get it into your lungs, straight through to your nucleus accumbens and your hippocampus, right into the brain, as I said, crosses the blood-brain. And these are ancient, very ancient central reward mechanisms, right? Nicotine's very rewarding, right old brain, unfortunately for us, over which you don't have a lot of control. It's like saying, okay, I'm hungry and I need to eat, I'll eat anything, right? At some point you will eat anything, and at some point nicotine addicts will do whatever they have to do to get it. So I'm just pointing out it's ancient central reward mechanisms. One of the things that's happening with vapes intentionally now is to make them, like I said, right at the top of that pyramid, is to make them really addictive. Intentionally make it so that when you inhale, the vape itself goes right into the arterial space, right into the alveolar space, into the arterial blood. Think your anatomy, think arterial blood right around your alveolus. And so the vapes now, that's called the flux of nicotine, how the apparatus is made to give you the dose right deep into your lungs intentionally. And they, unfortunately, think that the technology will make it easier for you to transit, and this is how it's been talked about, transit from smoking to vaping easily. Now that was meant to be the philosophy behind the harm reduction is let's get people off smoking and onto vaping quickly so that it's not problematic, they don't have to get used to it, and it's really rewarding, which it is. Unfortunately, of course, there are people who've never smoked and gone straight to vaping and get this massive dose of nicotine into their alveolar space and into their brain really, really quickly. But this transition story has become a bit of a problem because you can't transit out of it. So one of the biggest problems we have with vaping is it's so addictive. When people recommend it, they fail to remind you, what is your exit strategy? The fact that it's very addictive. What are you going to do now? Is this something you're going to do? Are you choosing to do this for the rest of your life? It's a caveat I think we should put on anybody who we recommend vapes, that they be aware it's highly dependence producing. It's a major risk factor for the future, for their future, and that they should be aware it's part of our informed consent. So I talked a little bit about this bioavailability already. I think I'll just go past it just to remind you, however, that what people are doing is saying, you know, the depth of your inhalation matters. You hold your breath, this is called the topography of your smoking. You might take a big drag in and hold it. You hold it for 2 seconds, you're getting double the dose. So how you smoke this thing, whether you're puffing lightly, puff, 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 20 cigarettes a day, or vaping, puff, 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 and it's all in the air, or you're getting it into your lungs. So it's very complicated, especially when you're trying to quantify how much people are using. I'm using a whole vape a day. I'm using a whole vape a week. It's very hard for us to know. We are now developing independent biomarkers, which I'll show you, to be able to see what you've got in your bloodstream. You might be doing exactly the same material, using this, the same amount as your friend, but you're getting double the concentration in your plasma compared to somebody else. So that you're wondering, why is it difficult? And there we're all using the same thing. Well, it's what you're doing and what you're getting out of this. And you might compensate. We know with smoking, people compensate. If they cut down, they hold their breath longer. So cutting down isn't always the strategy. It's not, I'm using less. And everybody goes, good on you, good on you. Yeah, well, hang on. Just because you use less, are you holding your breath longer? Are you smoking more of the actual cigarette? You don't know what you might even be doing. So it gets a little bit complicated, to say the least. And reminding you that these are all levels in nanograms per mil, and our smokers know how to titrate it to the nanogram. They're really, really good. Your vapors, so you might not like X amount in your brain, and I might like Y, and to get that, I will smoke accordingly or vape accordingly. Gives me exactly the right amount. How do we know? We've got lines in plasma levels of nicotine all the time. So we do these sort of analyses and studies all the time. But reminding you, when you're doing nicotine replacement therapy, and that's why I've got this here at the bottom, you need to know how much N you're replacing. It's meant to be nicotine replacement. And most of the time, if you've ever had somebody you know or you yourself have tried nicotine replacement therapy and it hasn't worked, it's a flag for you. You're not getting enough. That's the flag. Probably the biggest flag is you smoked while you were using it. I smoked while I was wearing a patch. I still had urges to use. I smoked less, but I still smoked. Therefore, it doesn't work. No, that's a flag. It was not enough. You're not giving them the replacement that they needed. So we now, multiple forms of NRT, multiple forms. This is a nice little diagram I did. Obviously, I've become enamored with ChatGPT. This to remind you, and we like to tell kids this about this, that there's a lot of this sort of thing going on. There's a lot of dead space in the upper airways. I don't need to tell you that, which means that, and there's no absorption of nicotine there. So you need it right in your alveolar spaces to get most of the absorption. And that's certainly with vaping even better, if you like. We don't want better, but that's what happens. And so you've got nicotine going in there, and there might be kids who do this and you don't know. You can't tell. The whole lot's out in the air. They're not getting any up in their upper airways, any absorption. And then they tell you, I use a whole one a day. Well, everybody goes, oh, that's terrible. But it's all in the air for all we know. And we know 80% is in the air. Hence, as I said, we have an issue with passive vaping because of this. Because what's in the air is nicotine in the air, which if you happen to be sitting next to that person in the car or in a room or a small, poorly ventilated space, you are getting. So that's why we have a significant issue, for which there's a lot of material now about passive vaping. Just like there was about passive smoking, we have an issue now with passive vaping. Watch this space. People are going to get sick from this. Just a question of time. So nicotine itself, this myth that it's benign, I mentioned, there's this hierarchy of things. The heart in particular, it's underestimated, I think, by most of the community, but we who work in the area are very strongly concerned about the acute effects of nicotine. You'll have remembered this, that nicotine does this vasoconstriction. It can raise my blood pressure. Renee, who doesn't do this, might have a few risk factors, but I don't do that. Age might be one of them. Right? If I vape, me, Renee, who doesn't normally vape, up goes my blood pressure. Nicotine's a vasoconstrictor. Remember that. Especially if I put a patch on, it's not going to do it. But if I vape, fast delivery, vasoconstriction, up goes my blood pressure. So it does matter if you're taking blood pressure. When was the last time that person vaped or smoked? It matters. If it was an hour ago, okay. If it was just before they came in or just before you're seeing them, then it matters. By the way, blood sugar is the same. Blood sugar, blood pressure. It matters when they're vaped because nicotine affects blood sugar. So the nicotine itself, as I said, is not benign, but what we certainly know about vaping is there's no carbon monoxide, but there are reactions to inflammatory processes in the lung. We're seeing hidden COPD. We're seeing hidden COPD from vaping, just pointing it out. It's not always what you think it is. It's not smoking and the rest is benign. Vaping is, nicotine is benign. Not correct. We're seeing the effects of all the other products that are in vapes as well. I want to remind you, if you did not know this, good evidence for this, because I did a lot of papers and writing, and not just myself and my research, but my colleagues around the world have looked at nicotine as a cough suppressant. Did you know that? So most people don't. If you think about it, of course, when you inhale from anything, if it didn't have nicotine in it, it makes you cough. For example, a joint, as in other product that you might smoke, hopefully not, that if it doesn't have nicotine in it, if you don't add or mull tobacco with it, it will make you cough. Nicotine in the tobacco is a cough suppressant. You can inhale deeper without coughing. If there's no nicotine in it, you should cough. That's a normal response to particulate matter irritating your airways. Most smokers don't every single puff. They don't. Years and years into this, they might get some respiratory effect. But short term, people who vape, new kids, they don't cough every time they puff. They should. It'll be a healthier thing. But it suppresses your cough. I want to remind you of that, which is why asthmatics say, my cough got worse since I stopped smoking. Have you heard that one? It's not an uncommon complaint. Your cough reflex is coming back really well, excellent. We want that to happen. Cough reflex is subdued by nicotine. I want to remind you that each individual flavour, people think, the flavourings, and they put it in one package, right? There are thousands of flavours. We don't know what each individual cytotoxic effect is of each individual, so we're now looking at that. So you might like the mentholated, I might like the strawberry, I've got Lush Ice here, who knows what's in here and what the cytotoxic effects of this one is. And it might be my favourite flavour, or it could be pineapple for all we know, or hamburger flavoured. Who knows what effect that has on the we're working on that now, which is very complicated and quite concerning. I talked about addiction a little bit. I know we'll talk a little bit more about that in a minute, but just reminding you recently that there's been the paper come out from Australian researchers in the Cancer Council of Australia that makes it look like vapes might be carcinogenic. So there's been a big review paper just come out in oncology, the journal, highly respected international journal on the carcinogenic effect. Is it nicotine that's carcinogenic? Now that sort of gives you the heebie-jeebies, because we're worried about kids' long-term use, of course, what the future is for kids. We should have used what's called the precautionary principle. Be careful about what you recommend, because the future may not be as benign as you think it is. We're seeing increased oral effects. We're seeing vaping, and dose-related passive vaping effects. Cardiovascular ones are the most ones we're seeing for the moment. This is now. And of course, we see nicotine affecting medications, alcohol, caffeine, and metabolism due to the induction of liver enzymes. So I'm going to hopefully talk about that in a little second. Here's something you can see. Obviously, I'm enamored by this. I loved it. I put it together on the ChatGPT, and you're very welcome to take it and steal it and have a look at it. no problem, make a poster if you want, just to remind you how vaping affects blood levels, plasma levels, all the way to your feet. Keep in mind, nicotine affects every single cell in your body. It goes everywhere. It doesn't not go everywhere. Bones, every organ you've got. So I put this together very short notice, Chloe, if that's all right with you. But hopefully you can have a look at it at some stage, because once upon a time, back in the day, we used to see this peripheral vascular disease. We used to see what was called Burgess disease. People lost their toes and fingers. Primarily, this is a nicotine effect. It's not anything else. So it's been established for a long time. It's related to the cardiovascular effects, the vascular effects of nicotine. So don't imagine that this is a harmless thing to do, that there seems to be a notion out there that perhaps it's less harmful. Well, nicotine in itself is not benign. And that's really the takeaway story for this. I hope you like this post I put together very quickly. But I thought, gosh, yes, people haven't thought about what's going to happen to the vasculature of people who are vaping today. It will be a question of time. Wait and see.